Hi, I'm Peggy Pringle, Associate Vice President for Practice Management Services at the Texas Medical Association. And we're here today to talk about ICD-10 with Steve Arter, who's CEO of Complete Practice Resources. Steve is also an author and an educator. And also Denny Flint, who's President of Complete Practice Resources and a former CEO. So Steve and Denny, what is the physician's role with ICD-10?
Because of the increase in code specificity with ICD-10, the physician's primary role is providing those documentation elements with which to be able to choose a specific ICD-10 code, to be able to meet medical necessity, to be able to successfully submit a claim, and ultimately to be reimbursed. So again, the physician's role at the end of the day is not to focus on those 70,000 new codes for ICD-10. It's on the few new documentation elements. For example, a pulmonologist working with asthma patients. Asthma has 16 codes, ICD-10 for asthma has about 36. But we can't just call it asthma anymore. Now the physician has to indicate whether it's mild, moderate, or severe, or intermittent or persistent asthma. Those new data elements, as well as tobacco use, are all required now to be able to specifically code ICD-10. So again, what we've seen with the docs is this inundation in information for ICD-10. And you know, our poor physicians, we're dealing with meaningful use and RAC audits and Medicare cuts. How the heck are they supposed to get their arms around ICD-10 when all this is happening? So Steve recently did a series of workshops in Hawaii for a large state organization, and we had an epiphany.
Yeah, what we realized is that physicians really don't know much about ICD-10. What little they've heard is mostly that there are a lot of codes and there's going to be a lot of work and it's going to be a big change, but the details of ICD-10 they're not familiar with. And it was very enlightening for them to realize that their focus on ICD-10 simply needs to be documentation. By providing the documentation that they need to their coders, they give them everything they need for a successful ICD-10 transition to be able to bill. And I always go back, Peggy, I always go back to the same thing. My business for years has been helping physicians financially. And doctors need to understand that insurance companies will not reimburse for non-specific codes once ICD-10 takes effect. They will not. So in the example that Dennis just gave, if you use asthma, a non-specific asthma, they know that that doctor understands whether that's a mild, moderate, or severe asthma and whether it's intermittent or persistent. And without the use of that terminology and that documentation and those specific codes, they're not going to get reimbursed. And right now, one of the #1 reasons claims are denied in this country is for lack of medical necessity. That is a direct reflection of the lack of specificity in the diagnosis coding. So physicians have it in their hands to be able to long-term benefit their financial well-being by adding these documentation elements and by using specific codes. But the key for them and the job for doctors is the documentation. Physicians were at a tremendous disadvantage and are in ICD-9. You know, using an example of the 480 codes for a fractured patella under ICD-10 versus the 2 codes for a fractured patella under ICD-9. Doctors were disincentivized to document. There was no reason for them to document whether it was a transverse fracture, whether it was displaced, non-displaced, the degree of healing. There was no incentive because no matter how much documentation a doctor uses, they only had 2 codes, open fracture or closed fracture. And they knew they were going to get the request for additional information, so why waste the time documenting because they couldn't get a better code anyway.
Okay.
Under ICD-10, if they put down that that's a non-displaced osteochondral fracture, the right patella, its initial visit, and it's delayed healing, they're not going to get that request for additional information. They're not going to get that same denial that they got under ICD-9. So it's absolutely critical doctors understand that their financial well-being in ICD-10 will be a direct reflection of the degree of documentation and the extensiveness, and specificity of their documentation.
That makes sense. Thank you.